Hello, it's evening here in Ohio, so I'm just going to say good evening. I'm Linda.
And I'm Kathy Narina, and I'm here in Connecticut. So we're kind of covering a lot of the country. And Linda, this is a nice opportunity for us to talk about really two of our favorite topics, health and behavior. I'm a human animal doctor, a family doc, and a dog trainer. And Linda,
Well, oh,
you
yes,
have
yes,
other credentials?
right. So Kathy's an MD and I'm a DVM. And between us, we also have a KPA certification. And Kathy, you're a certified nose work instructor, and I'm a tag teach level 3. So we really love giving these talks together because we can approach it from both the human and the animal end. And today the animal end is going to be dogs.
Yes. And Linda, we started with this quote, which you've
Yeah.
added to our conversations. Really
Yeah,
talk.
it's a quote that I really enjoy, and I think that it is pretty apropos. You know, so that is what that is. We'll go ahead and get started. Okay,
And I'm
hold.
sitting
I
here
got-
trying to do something with the slides, but Linda, you have control.
Yes, I do.
Yes. So we'll be talking about health and behavior. And as is often what happens, um, we start talking about these topics and we start asking ourselves questions. And here we were talking about, is there a match or a mismatch with the health and behavior?
Right, and we can also add in with the person and with the dog.
Yes.
Sometimes that's a mismatch or it's perceived as such. So it's just something to continue to think about as we go through this. Also, in my mind, it's can also be like a rock, paper, scissors game. If
Mhm.
you're going out and you both do the same thing, then it just merely starts over again. Nobody won, nobody lost. It's a draw. But in order to win that game, you have to, in a sense, cover or stop, or in some cases, you think about it as when you're actually doing the game, is destroy that other thing or that other hand, that person with the rock, paper, scissors. I mean, that's the theory behind the whole game.
Mhm.
And so this is also the match and mismatch. Here, if
Yes.
it's a mismatch, you lose, or
Mhm.
somebody loses and somebody wins. And we want to make sure that in our interactions with our dogs, that it's not that anybody loses. Even if it's a mismatch, we want to try to be able to ameliorate that and not have it be so drastic. We
Um,
also want to make sure, right, that Kathy, that we're on the same page.
yes.
So go ahead.
So kind of as an overview, we'll look at what is behavior, try to define that um, a bit, at least for the function of the dog. What is health? What are some of the common causes of dysfunctional behavior in dogs? Why a medical exam is important? And Linda, you always make a very good point about dysfunctional behavior. Had the graphic that crossed that out.
Yes, absolutely. There is no dysfunctional behavior, really. All behavior has a function. Therefore, defining it as dysfunctional is not really helpful to us or to the dog. And so I always cross that out because a lot of people will say my dog is misbehaving, and other people just might use a bigger word and say he's got dysfunctional behavior. So I just want to be aware that that's not the direction that we want to go. We want to reframe that.
And as we go through this and kind of explore the topic a bit, hopefully we'll have a better understanding of the importance of the medical exam and what it might look like and how and when to seek additional help or advice.
Yeah, absolutely.
So behavioral health, a lot of components, whether it's physical, mental, emotional, or even genetic. health. So it makes really kind of understanding and assessing behavior complicated.
Yeah, and it's getting more and more complicated all the time. And one of the reasons is, and actually COVID had a lot to do with this, a lot of money that used to only go to the study of human problems, either physical or mental problems, is now going into animals. And partly that's because the scientific community is becoming more aware of the fact that because behavior is behavior across species, that studying how dogs and other animals behave is becoming very, very important to understanding more about how people behave.
Mhm.
And the diseases, same thing. And as we get going here, you'll see, especially in, say, the GI biome. And so it's getting more complicated month by month.
So when we said we talk about or define what is behavior, and just as a general definition for today, we're talking about observable actions or responses to either internal or external stimuli. And you have the graphics really highlighting observable because that's very important to you to
Right.
emphasize.
Yeah, and because if it's not observable, it's not something we can comment on, whether it's a person or whether it's a dog. We can't tell ourselves stories. Well, we can, but we shouldn't tell ourselves stories about what's going on in somebody's mind or thoughts, or what's going on inside the dog's mind. We'll never know the full truth of that.
Right.
And so we want to make sure that when we're talking about behavior, we're talking about what we see, not what we think the dog or person is thinking,
Yes.
because most of the time we're going to be wrong. So
Yes.
you don't even go there.
Yep. So, and we use this to try to predict or understand motivation for behavior. There are some similarities with between human and animals. Both species, organisms, are functioning based on survival. So they're fueled by adaptation and reproduction. And then,
Right. Yeah, go ahead.
yeah, um, then we have the instinct response, right? The fight, flight, freeze, or fawn.
And that fawning is a relatively newish one that is being added when you say it used to be just fight or flight. And then there was freeze, think of a deer in the headlights. And now there's fawn, oh, another deer. Anyway, where you are kind of trying to placate the thing, the person, that's whatever is frightening you or causing this whole instinctive response, is you try to make everything okay. So, yep, go ahead.
Yeah, and then in that whole context, we're depending on some level on social groups and resource sharing, and behaviors will kind of conform to social norms. And within that, there's variability what an individual will want in terms of socialization, being part of a group, being a little bit more isolated. We see that with people. Do you see that with animals as well?
Yeah, absolutely. Just like you have people who say, nope, I want no part of society. I'm going to live off the grid and I don't want a social group, even if it means I could possibly die because I'm by myself. Something happens, I'm in the wilds of Alaska or something like that. Nobody's going to come to save me. I'm okay with that. So you've got people who will do that, and you have animals who feel very much the same way. And then you've got the people and animals who are clingy, or we'll say, who they can't do without their social group at all. They just, it just, they aren't comfortable like that. So yeah, we see that a lot. Um, some of the animal, those are some of the similarities. So now we look at some of the differences. And cognition is a big one. We always say that with people, that our cognition is well developed. It includes abstract thinking, verbal or language, and self-awareness. And we're really very proud of this, because we feel we're the only ones that have it. Well, but hold my kibble. Research on language and self-awareness now is startling. We're starting to see that animals may not be verbal, but they may have language. And they are starting, we're seeing them showing self-awareness. Think of the giant apes, for instance, who can recognize themselves in a mirror. That's part of self-awareness.
Mhm.
And think about elephants who are communicating 30 miles underground, something we were never really aware of. And now that we do know it, they can tell the other elephants that are far away where they're headed, how many are in their group, whether there's danger. That's communication. So watch for what's happening in research and cognition.
Yeah, and speaking of communication, we humans like to think that, we have these complex ideas. We have language to express the complexity and, kind of discuss these concepts. And we also have technology.
Which is how we discovered that animals might have a form of language and self-awareness through technology.
Right. And their communication may be more complex than we originally gave them credit for.
Right, right.
Right? They have vocalization, body language, but the research is, challenging the assumptions that it's limited to that.
Correct. Then we have the emotions. Emotions can be subtle, and we often differentiate them and we put words on them. In English, we would say guilt, pride, and all of these kinds of emotions can be heavily influenced by culture and also by your family group or your smaller group within that culture. With animals, it's less influenced by social norms or constructs, and it's not thought to include complex emotions when we think of the abstracts of guilt and pride. However, stay tuned because they're feeling that there are some animals that show jealousy, for instance, and it's complicated, but it's really exciting and really good.
Yeah. And then there's learning and learning theory. And humans have different ways of learning. They learn individually, they learn in groups, they learn informally, and they learn formally with kind of a purposeful learning. And with animals, it's always been thought to be a little bit more instinct driven, trial and error, imitations. But it's always interesting to talk with you, Linda, because you make me aware of some of the new literature that says there may be other types of learning animals are doing.
Right, animals may be learning formally, that purposeful learning. They're finding animals that are taking aside, say, younger animals and are actually teaching them something, showing them something. And it's not just imitation or just the parent or the older animal just doing what they do, and then the younger animal following along and learning how to do that, where it looks much more formally prepared almost. So again, pretty exciting.
Yeah. And then we want to talk about or define what is health. And I love the kind of holistic definition where health is overall wellness, it's mental, physical, and emotional states. Um, it's not just the absence of disease, but it's also the ability to function in the environment. And that's kind of a powerful definition and yet concise. We're thinking of social environment, physical environment, and the emotional environment.
Yeah, yeah. In order to be healthy, it's so much more than how you feel when you get up in the morning.
Mm.
So,
And so we really have that attention to the behavioral and mental health more so than we used to, which is very nice. Um,
yeah, yeah, we're now also talking about the effects of trauma, and we do have trauma down there twice. There's big T trauma. That's the big thing that you might think of when you think of military personnel who come back and they have PTSD or something along those lines. It's a big event, one-time thing, or just a few times, and there is that. But there is also small T trauma. And those are the small traumas that in and of themselves, they aren't bad. You say, huh, that didn't bother me. And you go through your day, you keep going on. But those small T traumas add up, and you just keep stacking them one on the other. And then it can become the same effect
Mhm.
as large T trauma. And this is being well studied. Both Kathy and I work with trauma informed, in Kathy's case, or trauma assumed care with our patients. And
Mhm.
it's a very it's a very powerful thing and can affect a lot of behaviors. And
Yes.
it's only now really being addressed holistically. So now we're going to go into human illness and the potential impact of how people feel on dog behavior.
Because inevitably, Linda, when we start doing these talks, we ask ourselves questions.
Right.
And so we know there's a lot of studies that are just, heartwarming that talk about how the health benefits people get from animals, which is great. But when we're looking at this and, kind of how health can adversely impact behavior, it makes you wonder, how does human health impact an animal's well-being and behavior within the family? And when we're talking about illnesses, it might be neurologic, maybe dementia or Parkinson's disease. It may be more physical, limited mobility or chronic pain. There may be cancer. We're thinking about mental health, whether it's anxiety, depression, or mood swings. And as we were looking into the literature, respiratory illness came up on some of the searches, or emotional and environmental instability, and how can that impact? Um, for neurologic conditions, when we're thinking about things like dementia, Alzheimer's disease, or Parkinson's disease. Um, Kind of what we found is a lot of the literature that says, oh, there's health benefit. But I think we became concerned, and we'll probably see it in the next slide, um, that positive impact, but are there potential negative consequences? And here's where, Linda, we often talk in terms of evidence-based medicine and having really good quality studies to have. And sometimes you start asking the questions and you're really kind of developing good research questions and hypotheses that need to be tested with good research. But we're seeing that develop, just like the other research that you were talking about. Hold your kibble, there's more to come. So I'm sure we'll be seeing more of that evidence-based research. Some of this may be a little anecdotal, um, but what we were thinking with kind of the next slide, when you think about dementia or Alzheimer's disease, you may see caregivers, when they're taking care of an animal, have erratic or inconsistent caregiving routine, or there may be a lack of attention. So someone may forget to feed their dog or feed their dog too often. And for the pet, that might cause frustration, confusion. And as dog trainers, we know kind of the consistency is very helpful to encourage good behavior. So you can see where Alzheimer's disease, if that is the only caregiver or the primary caregiver for the pet, or dementia, can have an impact on the animal's behavior.
Yeah, and at One Smart Dog, which is the dog training facility that I have, we often have people bringing in a parent who has usually early onset dementia, because by the time they are in a care facility, they often don't have their pet. And they want to know, but the child, I guess, actually
Mhm.
wants to know, what can I do? Because this pet is what keeps my father, my mother going, in a sense, but they're also mean to the pet,
Mm.
and they don't know that they're doing that. And so I think that we can pretty categorically say that these neurologic conditions are very stressful on the animal. And the question is, what do we do about it? And what is the right way to proceed? What is fair to the animal? What is fair to the person? One person that I know, one child, gave her mom a stuffed animal that looked exactly like their cat.
Huh.
And she just carries it around and she pets it, she shows it to everybody and treats it like it was her cat. So it worked for that person. So sometimes there are workarounds.
Yeah, and we were going to talk about case studies, which we'll have more of as the talk goes on. One case that comes to mind for me as a human who had an animal that was impacted by the Alzheimer's disease was a case actually in a rescue that I work with. Someone contacted us. They needed to surrender one of two of this person's small dogs because once that patient developed dementia and needed to have caregivers come in, that dog started showing resource guarding and was biting some of the home health aides that were coming in. And then the home health aides weren't coming in, they weren't able to get the care they needed. And that was behavior they hadn't seen before in this dog. Of course, there weren't as many people coming in and out, but it can be really heartbreaking.
Yeah, it can.
Parkinson's disease is another neurologic disease characterized by tremors and unsteady movements. It may cause the dog to avoid the owner or maybe become more protective, like like we saw with that gentleman with the Alzheimer's. And some of the reports are owner reported on forums or other areas, that kind of patient's lived experience. And they reported change of behavior when they were having a flare or where their symptoms seem worse, whether it was because they were tired or something like that. I think that's what they meant by a flare. They would see their dogs change a bit. Some dogs were running from their owners. Some dogs, according to the patient, were showing more aggressive behavior. But patients were noticing their kind of lived experience did show a change in the pet's behavior.
Right.
Chronic pain, reduced mobility in a person. If a human isn't able to move for whatever reason, the animal may be getting less exercise, less enrichment. We may see things like excessive barking, chewing, hyperactivity. In some of the studies and reports they were talking about for non-canine or for cats, they're dealing with less cleaning of the litter box because it's just difficult for the person to do.
Right.
Cancer. Hard to say one specific thing for cancer because there's so many types and stages of cancer, but we do know that dogs are being trained to help detect certain types of cancer so they can sense that. I know that I've had a patient and several of my colleagues have had patients where the person came in for screening because their dogs were acting differently. So change in behavior in that instance, maybe nuzzling more or more focused on an area of concern. So certainly cancer may impact that. For mental health, studies look at conditions in people with depression, anxiety, and loneliness. And we're not talking about service dogs that are trained to assist with that. We're talking about pets that are living with someone with this condition. And again, they've done surveys of owners of pet guardians. In the study, they talked about owners, but pet guardians where they reported behavior changes. Some reported increased dog aggression, some reported fearful behavior. There may be more leash pulling, there may be decreased behaviors like a more poor recall. And because these are surveys, they didn't have a causal effect yet identified. But as I
Right.
said, more research going on.
Right.
And one I didn't really expect to see, but found when we were looking at what type of studies are out there, are respiratory illness. And studies have suggested that dogs will reduce their activity when their caregiver is physically limited by respiratory illness, which seems so lovely, like that kind of that bond, that human animal bond. And they talk about a term called behavioral synchronization, where dogs synchronize their behavior with their caregiver's behavior. Certainly not all dogs will do that, but there's that tendency, that propensity for humans and animals to synchronize.
Yeah. And that also leads us into emotional contagion,
Yeah.
which where dogs take on the emotions of their caregiver. And if their caregiver has an increased heart rate, so will they. Increased heart rate variability, increased cortisol levels because of increased stress.
Mhm.
And there are some really robust studies out about emotional contagion. And so this is really significant when we talk about human health and then canine health as an association there.
Yeah.
There's no doubt that dogs do take on a lot of our hormonal changes as we become stressed, anxious, afraid.
Mhm.
Yeah.
Um, and then that kind of brings us to the next part. We're thinking about how human health may impact animal behavior, but animal illness, canine illness may impact behavior.
Yeah, absolutely it does. So what I'm going to do here is I'm going to take it step by step with the people that may be involved with the behavior of a dog. And then we're going to talk about how medical health of the dog is going to impact what the trainer does. So the initial assessment often does come through the trainer. It doesn't come through the veterinarian. It can,
Mhm.
but I'm going to take it from somebody says my dog is behaving in thus in such a way, and I would like to change that. So come to the trainer, and what is the first thing that the trainer should do before they even see the dog is they need to get a behavioral history. And I'm going to quickly just show you here the one that we use. And it's a little bit complicated. This is our behavior consultation form. And I always warn people when I'm talking to them, I say, I know this is going to be a few pages long and maybe longer than you expect, but it's really important that you fill this out because it's going to shorten the time that the trainer is going to have to go over these things, and it'll increase the time you and the trainer have on one-to-one, your discussion. And
And
so,
Linda, did you open the form? Because
yeah,
I'm not seeing it. I don't know if anyone else is seeing it.
really?
Hmm.
Yeah, I'm looking at it right here.
I don't know if you need to
Because
change.
it pulls you out of your screen, we can still just see the regular presentation. We can't see the separate form.
Oh, okay. When we looked at this earlier, Kathy could see it on her laptop, which is why I thought you would be able to. Okay. Well, let me just describe it. It's okay. It's blue and it's got highlighted lines on it. But in any case, what it is it's informational in that it has all of the client information and then it has an about my dog. And it isn't just name, breed, age. It's asking them specific information. Do you have a fenced in space? Where does your dog sleep at night? And it also goes through veterinary information. What are your dog's vaccines? Are they up to date? Can your dog, goes back and forth a little bit, can your dog safely be left alone in your house? And so they answer all of these questions, including can they give up anything that's in their possession? And they talk about other family members. So it's a long 3 pages and also asks about, has a dog ever bitten? And then we get the name of the veterinarian, any health problems, any medications, what they feed their dog, how much they feed their dog, and then importantly, what are your goals for your dog? And is there anything else you'd like us to know about your dog? And then they have a pretty full list that all they have to do is check, my dog has problems with. And then we list, say, men, women, delivery people, people running, bikes, that kind of thing, people coming up from behind. Or my dog has problems with the following inanimate objects, and there are about 25 inanimate objects on this list that they can just check. Yeah, hates trucks and that kind of thing. And then my dog has problems with other dogs when they, and then we list things, make direct eye contact, when they approach head on, when they are on a leash. So we've got a list there, maybe about 15 things. So it's pretty thorough. I recommend the thorough consultation forms because, well, let me put it another way. I was advised to do a form that was maybe 5 questions long. and then get all of this information when they came in person for the assessment. And I really push back on that. I think it's better to have them take the time at home where they aren't stressed and, or less stressed, I hope, and to fill this out and to really think about it and then send it in. And it also gives them some commitment to actually coming in to the assessment, paying for and coming into the assessment. So I like to see this commitment, and it's information that I really like to have. So we'll try to get this into the show notes for you.
And it does remind me of kind of the adage in medicine, right? 90% of your diagnosis is in the history.
Yep, absolutely.
So
It is in the
getting that
history.
information is going to be very valuable.
Yeah. So these are also with the initial assessment. So you have the behavior form as a trainer, or then you're going to have the initial assessment where everybody's there in person. So in the form, we've already asked, what are your goals for your dog? In other words, why are you here? Why did you contact us specifically? But I'm going to ask the trainer to ask this in a different way. So if there are any trainers here, what I want you to think about is, why was the dog brought to you really? In other words, what they're saying may or may not be the reality. And Kathy and I call it the Columbo moment. And just before they're ready to leave, you've got your hand on the door, they're standing up, putting on their coat, and they turn and they say, oh, I forgot to tell you. That's the moment when you really want to pay attention, because that is usually the crux of the matter. So that's this first one with the paw prints. Why was the dog brought to you? Pay attention. This isn't a question. These aren't questions. Well, these first two are not questions you're actually asking the client. These are questions that you are listening for, that you're watching for. Through your observations, you're saying, aha, this is why they brought this dog in. And also, why did they bring the dog to you and not to a different trainer? That's really important if you can sort of get a feel for that. Then the next one is, how does this caregiver feel about bringing their dog to you? And in this case, I'm maybe not saying the you, I'm emphasizing how they feel about being there for the training. Are they stressed? Are they angry? Are they worried? And that's something that you can tell or get a good feel for just by observation. And you want to make some notes on these. These are private notes where it's going to help you get buy-in perhaps later on. It's going to help you know how to approach the person in this bonded moment
Yeah.
of the three of you, the dog, the caregiver, and the trainer.
Yeah. And I think we've talked about that kind of trauma-informed care
Mm-hmm.
that's been helpful for us. Oftentimes that Columbo moment, that, door on the handle, is the person is waiting to see if they can trust you to
Yeah,
be a
absolutely.
little bit vulnerable.
Yep.
And then looking at it holistically and, wondering about the support at home, really allows us to get good information. And if we're being considerate and compassionate with how we're addressing the clients, also really empowering them to make the changes they need for
Yeah,
their animal.
right. And then the last question is one that all of us who have been to a hospital or a physician in the past 10 years, but especially recently, post-COVID, get asked this all the time. Do they have support at home? And this is an actual question. And support can be just that people think this is a good thing, that they're coming to seek out help for the behavior of their dog. And it can be community help. It can be somebody who lives alone but has friends who think, yeah, you're doing the right thing, and somebody to help them move forward. And Kathy, you have to say this dozens of times a day, I'm sure.
Yeah, and it really can impact your plan going forward.
Right. Right. So again, we're still in the initial assessment. And we want to say, what does the dog look like to you? Not what does the dog look like to the caregiver, because as a trainer, you're a professional, and there are things you're going to notice that the dog's person is not going to notice. So you're going to observe interactions with the environment, with the caregiver, with you, and you're going to keep detailed notes. You can always shorten them later. And now, hooray, you can use AI to summarize and notate. So if you record the session or video and record the session, AI will go through and bullet point it for you and rephrase it. It's really a nice service, and it's something that we should all be using. And my pro tip of the day, take a note, be sure to set up a tripod with a video in the parking lot. You want video of what happens from the moment that person drives to your facility and gets out of the car. What do they do then? How do they get their dog out of the car? What happens? I've had people that I didn't know did this until I looked at the video, because I'm not out there often at this point in time, who did bring their dog in, say, on a choke collar or a prong collar or an e-collar, but they knew that we were a positive reinforcement facility because we talked to them about that. So they take it off and they toss it into the back of their car, and they come in on a nice little flat buckle collar as I asked them to. But now I don't call them out on it. I don't say anything, but it's information for me about some of the care that that dog is getting and how the people feel. They're worried, they're afraid. That's why they use those. And something that will need to be addressed. So set up a video, even if you're not out there. A lot of times, if it's a reactive or aggressive dog, I say, don't get out of your car. We're going to meet you in the parking lot and we'll help you get into the building. And even then, you should just have a video set up. So that's my pro tip. It'll really help. You'll be amazed. So with the prior client knowledge and a waiver signed, you want to video the entire session. And this also will help record the client interactions, their body and facial movements while you're going on with the conversation, and the dogs. Because remember, while we're really skilled at paying attention to multiple things at once, as dog trainers, you are going to be paying attention to the people, the dog, you're going to be writing notes, responding to questions. We're also giving information, and that's a lot. It's a lot of stuff. It's nice to know you have the video running and you can go back and look at anything that you think you might have missed. And this video review can become part of the client record. Finally, consider at the end, is this a case you're comfortable with? And if you're not, refer to a colleague. Refer to a colleague you respect and that hopefully you can work with so that you can follow up and see what happened. If you are comfortable with it and you're going to take this case, recommend a veterinary medical workup. I want to repeat, recommend a veterinary medical workup. You really have to do this. Why? Because it's the right thing to do for the dog, for the dog's caregiver, and for your liability as well. It's also good for you because if they do have a problem, it's going to be something that needs to be addressed, and a lot of their behavior could be due to that medical problem. And if they don't, well, then you can go ahead dealing with the behavior, being calm that there is no underlying problem. So medical referral is very important. So referring to a veterinarian, this is where a lot of trainers struggle. So this is what I would recommend. First, you ask who their current veterinarian is, and you refer to them. You're not going to ask them to go to a different family doctor. However, if they do ask you, then you can refer to a veterinarian that you feel is well-versed in behavior medicine and who supports positive training. You do not at this point have to refer to a veterinary behaviorist. In Ohio, for instance, we only have two, possibly a third one just came in the whole state. So there are veterinarians that are in between that, more than a general practitioner of focus on behavior, and then there are veterinary behaviorists. So at this point, you can feel comfortable, unless this is a really egregious case, referring to a veterinarian that's well-versed in behavior and knows about behavior medications if needed. And hopefully it's one that you're able to work with. Once they have an appointment with this veterinarian, you want to get the caregiver's permission to send your your behavior assessment to that veterinarian. Do not make any medical recommendations and don't make any behavioral medication suggestions. Your report should be general but complete. I've included here, I don't need to read it, referrals to a veterinarian example. In other words, a letter about what you can say as you're referring a mutual client to them and how to word that. You want to make sure that after you've written it, that you sign your name and any certifications that you have. So now we're on to the medical assessment and dog behavior. So now I'm there from switching from the trainer's perspective to the veterinarian's perspective. When I see a behavior case at the hospital, I love receiving information from the trainer. So everything I said before is what the trainer ought to be thinking of, knowing that it will be well received by any veterinarian who has an interest in behavior and an interest in that client, which they should have, because that person is already a client of theirs in most cases, because that's who you're referring to. So be at ease. I know a lot of trainers are very nervous about this part of it. So you want to send a copy of the behavior form. You want to send a copy of the assessment you sent to the client, which includes a training plan. And you want to provide a functional assessment, because that's appreciated. And it also lets the veterinarian know the trainer is both diligent, detailed, and knowledgeable. Now we're going to move on to what I consider a minimum database for all behavior clients. First is a thorough physical exam. This includes an oral exam for lesions, a dental exam for dental distress, a neurological exam, proprioception, balance, awareness of their feet, for instance, an orthopedic assessment, gait analysis, retinal exam, ears, and skin. And just before we came on here, both Kathy and I were talking about the fact that we both have patients who have, for instance, abdominal problems, and the veterinarian or physician that they went to never did an abdominal exam. And it took weeks, if not months, to finally come up with a diagnosis, which was an abdominal diagnosis, which, had the exam been done, possibly an enlarged organ would have been palpated, or there would have been a specific area pain that may have been elicited. But we want veterinarians to take a thorough physical exam. Then blood work, a complete blood count, chemistries, electrolytes, a canine pancreatic lipase test, a GI panel, thyroid, and an SDMA, which checks kidney function. Speaking of kidney function, a urinalysis. You shouldn't get away without doing a urinalysis, and a fecal analysis, which is sent to the lab. We want more than what can be done at the veterinary hospital. We want antigen antibody testing, and we want to sort of get to the heart of the matter there with the fecal analysis. Those are the main ones. I also include the next three: a microbiome tests. Many of you listening may have been seeing a lot of things coming through your social media feeds or your email on microbiome and its importance in humans. very important in dogs, and we are finding a lot of behavior that's related to dysbiosis or an abnormal microbiome. And radiographs of the abdomen, and possibly, depending upon the presenting signs and the breed, getting x-rays of the hips and their back and more of their skeletal areas, depending upon, as I said, what the presenting problems are. And then, if indicated, an ultrasound, and that is usually for the abdomen, although it could be for any other part of the body, especially the chest.
And that's a lot.
That is a lot. And
But
I'm
it's
sure a
thorough.
lot of you were saying, yeah, what, Kathy?
It's thorough.
It is very thorough. And the things I find when people say yes to this are amazing. And some of them are things that I wasn't even considering. So very important. And so a lot of people look at this long list and they say, Linda, what are we going to do with that? That's pretty expensive, isn't it? And you're saying, yeah, but what if they can't afford it? Well, a lot of times people give me the deer in the headlight look, the freeze, and they say, I don't know what to do with that. How much is that going to cost? Or they can afford it, but they don't want to do it for various reasons. I mean, everybody has their own reason. So then what? Here we are. Are we at an impasse? No. What I do is I go with the odds. Honestly, I know a lot about behavior and I know a lot about veterinary medicine. And I can take some educated guesses. I let them know that's what we're doing because they've already said no to the testing, or they say yes to the urinalysis and yes to, I don't know, some of the other blood work because they have a certain amount that they're willing to spend and they want to say, but Dr. Randall, what is the top? Prioritize these for me. And I have $250 to spend. What should I do? And I can come up with what I would recommend that they do. They know already that they've pared down the big to a more focused area. That's okay. I'm going to look and I'm going to say, what is the breed? What is the breed mix or the breed blend? What are the clinical signs that may indicate what my priority should be? For instance, is the dog lame? Does the dog have a painful abdomen? Can the dog hear? I mean, there are a lot of things there. Does the dog have fleas? I mean, just the simple things
Mhm.
to help me start focusing. And then I'm going to say, is there an option that is not normative, but may give us all some needed information at a lower cost? And the spoiler alert is often yes. Then I think to myself, how do I present this spectrum of care in a compassionate and persuasive manner, i.e., no blame? How do I provide reasonable expectations as we have lowered, we'll just say decreased, focused, the recommended medical health diagnostics? And we want to provide reasonable expectations for the choices we do make. But we don't want it to be anything that says you're not doing the best for your dog. They are. They brought them into you. They've made good choices. And now we might have to be a little bit more focused on how we proceed. And we want to be really, really positive about that.
Yeah. And we see it in human medicine too.
Yep.
People
Yep.
making decisions just that is reasonable for them. And I really appreciated learning about spectrum of care from you because that's it. And presenting those options in a compassionate way.
Right. It's not less than, it's different than.
Mhm.
So let me say, what are the most common health concerns we see with behavior cases, and is there anything new? So I've listed here the most common ones that we see as veterinarians. And I'm going to say first, and this is also relatively new, GI diseases have gone from lower on the list to pretty much the top of the list. GI disease was I almost put it under hidden diseases here because GI diseases are often subtle and they're often intermittent. So the dog will be fine for a few days and then isn't. And nobody seems to know why. Sometimes they seem to be painful, often they don't. Often they're not vomiting, often they don't have diarrhea, or every once in a while they have soft stool. And somebody says, oh, somebody fed him something he wasn't used to, and that's why, he's got some diarrhea. Maybe so, maybe not. But GI diseases are high. And under that, we're going to I'm going to mention four. One is just inflammation and inflamed GI tracts. Think, an inflamed bowel, for instance. And that would be it, or IBD, or something that is immune mediated. The other one would be parasites. And good old hookworms, roundworms, whipworms, yes. But the parasite of the day or of the year or years is Giardia. It is way up there right now, right, Kathy? We see it in people, it's zoonotic.
Yep.
And the more rain you get, the more puddles, standing water, and with the climate change, Giardia is just having a heyday and a resurgence. And it can be completely under the radar. And it can cause havoc with the dog's GI tract and with their behavior. Then again, the microbiome and pancreatitis. The next would be urinary tract diseases, an inflamed urinary tract, whether it's the kidneys or the bladder, and kidney or bladder infections, but especially UTIs, a urinary tract infection. And dogs get a lot of them, and they can be chronic, and they can be just resurgent, not just intermittent, but it can be the same bacteria every time. And that's a whole different problem. But dogs can go months with a urinary tract infection, and people don't know why their dog is so disgruntled and grumpy all of the time.
Mhm.
And then the hidden diseases. And here we have cognitive decline. And it's the same with people, right, Kathy, that it can start very subtly, where
Yes.
people think that somebody just got confused.
Mhm.
Yeah. Dental disease. And any of us who have had a cavity or an abscess in our mouth, we know how we feel. Not good. It's painful and you're grumpy. And so dental disease is high in the list. Tick-borne diseases can cause lameness. They can be subtle and they can be intermittent. Respiratory diseases, skin diseases, musculoskeletal diseases, and there would include hereditary problems such as hip dysplasia, but also muscle tears, and of course, cancer. So those. So just to go quickly over a couple of cases.
Yeah, and Linda, I just want to interject because we're
Yeah.
coming up on 8 o'clock.
Okay.
And I want to be respectful of people's times and see if Miranda had a concern or a time limit for us.
Nope, if you've got more to say, we've got more to hear.
Okay.
Okay, well, we're going to continue, and if you do have to leave now, this is being recorded and you can catch up with it, and you can also put a question in the chat. And even if you aren't there, we will probably answer it. We'll give it our best shot. So here's a golden doodle who was brought into me, and female, 4 years old. For her lifetime, they've had her since she was 8 weeks old. She's been kind of picky about her food, but she maintains her weight and activity. She just likes some things, doesn't like others, and they just live with it, not a problem. She's recently started sleeping in different places, and they don't know why. And she's also barking when people approach and when dogs approach, but only when she's on a leash. And this seems to be getting worse. At the same time, a new person has moved into the house, and the caregivers feel the behaviors this golden doodle is showing got more noticeable, or even may have started along the time that the new person came into the house. So they started training with an R+ trainer at my facility, who recommended a thorough medical workup, as we do. And at first the caregivers declined. and they wanted to proceed with the training, and we did that. But after a while, without any improvement, they said, oh, maybe we'll go ahead and have that medical workup. So they did. Whoops. And it turned out this dog did have underlying gastrointestinal concerns. They are probably lifelong, and chronic inflammatory disease is what she had. And then she also had current dysbiosis or microbiome issues. We don't know which came first, the chicken or the egg there, but she has both. And she had subclinical intermittent pancreatitis. And the only reason we know that is because for other reasons, serial chemistries were done. So the first one, the pancreas appeared to be normal. The levels were high normal, but they were normal. No worries. The second one, they were a little bit increased. The third one, they were normal. The fourth one, they were a little bit increased. And we said, well, what's up with this? And we went back to the training record, and every time the little bit of increase was up was when the dog had a flare, when things got a little bit worse. And it was definitely related to an inflamed pancreas, which was just flying under the radar because it was intermittent. So we treated these problems, and well, I keep going back, sorry. And once these problems were resolved, some of them were not going to be resolved as in cured, but were treated and controlled, her concerning behaviors decreased or went away. She was able to reintegrate back into the family activities. So my comments, I could focus because they did come in, they did do some of the things, they didn't do all of the things, but doodles in general have a very high percentage of GI concerns. As a matter of fact, if you could call doodles, no matter what the other blend is with the doodle part, as a group, they have the highest percentage of GI concerns of any, we'll call them breed or breed blend. And it's something that concerns us as veterinarians, but we want to pay attention to that, and it's a way to start focusing.
Right.
So I'm placing a GI concern at the top as a reasonable alternative because of the breed blend and the presenting signs. From since she was a puppy, she was picky about her food. That was actually a sign. We just didn't know it. This dog had an history of intermittent anorexia, especially in the morning, and now she's wary of people or dogs approaching her, but was calm when they went away. And why? Because she was worried that they were going to touch her, and she had abdominal pain. She didn't want any tactile, goodness, information. The new housemate was actually irrelevant to the problem, but the housemate was there more, and whenever she wanted to interact with the dog didn't want her to. So to the caregivers, it appeared that the signs were getting worse when really they were all interrelated, didn't want people touching her or dogs. So another case, an Australian Shepherd, 20 months old, male agility dog. He was a reactive puppy that had stabilized with one of our trainers. And at 16 months, he was in agility, but he started reverting occasionally to his reactive behaviors, but he was easily redirected, and things were going on. He was doing well and seemed to be fine otherwise. He joined another agility class where occasionally he'd start reacting to the other dogs, and at the same time wouldn't jump or weave with enthusiasm, which he usually did do. So he was sometimes lethargic for a few hours and then seemed to rebound. We recommended a medical workup, and he was referred to his family vet. A GI problem by his family vet was presumptively diagnosed because he had a current onset of intermittent diarrhea and decreased appetite the week that he had his appointment. So she put him on a GI plan, but things didn't really help a lot. And at about 19 months of age, so here we are, we're talking a couple of months later, his particular trainer noted that she felt he was losing more weight, and she recommended that the caregiver return to the veterinarian. So after several different treatments, radiographs were finally taken, and a malignant splenic tumor was found. And he passed away from an overt hemorrhage 2 weeks later. So the medical workup could have initially included a complete blood count and abdominal radiographs. Both of these most likely would have pointed in the direction of small intermittent bleeding from the tumor and an abnormal spleen. Also, we want to remember, speaking of abdominal palpation, a thorough abdominal palpation on the initial physical exam may have revealed an enlarged spleen and a painful abdomen, which is why he was grumpy and why sometimes he didn't want to weave or he didn't want to jump. His abdomen hurt, and then he was lethargic and tired because he was hemorrhaging. So his blood count was going down and he was tired. But then that seals off, and this is very common with these, it seals off, the red blood cell count rebounds, and he feels fine again until he doesn't. So this is something where if the finances to do the testing weren't available, a GI consideration in the beginning was reasonable. But the other thing that could have been done, right, on the lower part of the slide there is a packed cell volume, that's a PCV, where we just spin down a little tube and we see what the red blood cell count is, and a blood slide, which would have told us whether he had blood loss and his red blood cells were regenerating. Both of these are very, very inexpensive, and I'm talking less than $50. And they may have shown anemia and regeneration of the right red blood cell count. Therefore, they would have been looking for areas of bleeding, and the spleen is one of the first places you look for that. So it may have been found if that had been offered. So this is where we could focus and say, they don't have enough money for the full test, but I can look at this.
And it's a nice reminder that part of spectrum of care is evaluating.
Right,
Is the treatment working or not? Do we need to broaden our differential?
right, exactly. So with the discussion here, a malignant splenic tumor is in a dog this young, he's not even 2 years old yet, is very unusual. I don't know a veterinarian out there who would have said, oh, I bet he's got a tumor on his spleen. We would have said, I wonder what's going on. And he did have an unusual tumor on his spleen. It wasn't the hemangiosarcoma that we often think of. So this was a zebra. When you hear hoof prints, hoof beats, sorry, don't think, you think horses. This was the zebra. It would have been expensive to treat, even had they known it was happening, and it would not have had a different outcome. But that's just something to know. But here's where behavior and physical health really intertwined. So after musculoskeletal problems, the most common underlying problem I see in my practice and training is subclinical, usually intermediate pancreatitis. So if I'm going to focus on a problem, I am always going to recommend a pancreatic test. It's not that expensive, easily done, and I want to rule that out right from the get-go. That's how much we see this. So behavior cases, they're often prolonged and expensive. The medical exam is usually a short time, but it's also expensive. But behavior modification without a medical exam can be extremely frustrating for both human components, the trainer and the caregiver, and can be also frustrating for the dog, if you think about it. Things aren't going their way, and we don't know why. If a medical exam does reveal an underlying concern at a later time, so you're 6 months in, and the people say, I took my dog to my veterinarian and here's what they found, and it was something that relates to their behavior, and you did not recommend a medical exam, that's liability. recommending a medical exam is the right thing to do, and it's also our job. We want to recommend what's best for the animal. We want to advocate for them. That does not mean we don't also advocate for the people. But we do need to recommend it, and then we need to be flexible. And we need to know our job, and we need to be able to focus in on the needs of the people in relationship to the needs of the dog.
Yeah, and hopefully kind of sharing this information and sharing these both perspectives, trainer, veterinarian, it can help make those conversations a little bit easier so that we can really get the full benefit of the whole team for that dog, the family, the trainer, and the vet.
Yes, and the number of times that when we get to this, I guess we'll just say this part of it, people will say to me, I didn't feel comfortable saying this to you before, but I am high anxiety. I cannot let my dog rest at home because I'm always worried about, I'm always checking on him. I'm always doing this. Nothing is ever good enough for my dog. I can't relax. My therapist has me on all sorts of medication to decrease my anxiety. And I can tell it's my anxiety that is causing this problem in my dog. And my therapist has also said that and has said that I need to seek help for my dog as well. Sometimes I'm medicating dogs because their owner is being medicated. And
Sounds like an
they
emotional contagion.
yes, and they can't, their dog, they want to think of their dog as an emotional support animal, but their dog's in dire straits too. So their dog essentially does not individually have a behavior problem. But because of what Kathy just said, there is something that we need to help that dog psychologically. So this is all so tied in. So I also want to remind you that even though we have all of these medical cases, you can have a dog that's in front of you that is just a behavior case. Or like the one I just mentioned, because I wanted to bring that in, that the person has behavior issues that are being helped by their physician, their therapist, and now we need to help with the behavior of the dog in relation to that. But if that combination, that mismatch wasn't there, we might not be having to give behavior modification or medication to that dog. The dog could be normative, but isn't in this situation. So it gets complicated, but you need to know which way it's going because it's estimated in the literature that between 50 and 60% of significant behavior cases have an underlying medical concern that is either very much affecting or causing the behaviors. So to wrap up, Kathy.
Yeah, I think we've kind of been talking about this throughout the talk, but it really is caring for the unit, the family unit in front of us holistically.
The bonded family.
Yes. And ruling out or in medical issues. The careful behavior notes will be helpful.
And detailed, that's what I mean by careful.
And being patient and compassionate. I think we can see where there's so much going on, so much to consider, that doing it with understanding and support to really empower that pet owner is good. And we've already highlighted some of the recognizing the emotional contagions and the synchronized behaviors. And the value, don't hesitate to bring in your interdisciplinary colleagues.
Right. Once you have a behavior issue, you might be looking at somebody who is going to do some physical therapy. You may be looking at a board certified behaviorist. You may be looking at enrichment and getting someone to really help them with enrichment, a dog walker, for instance, to get the dog out of the house. There are just so many colleagues that can be called on. And it's a nice group to have if you have all of these other professionals that you can refer to and discuss cases with. It's very helpful. So remember, in closing, health influences behavior, behavior influences training, and training influences behavior. And so that's your little graphic, because it just goes round and round. Everything affects everything else. Some books that we recommend, some of these are new, such as Manage It and Who Keeps the Dog, are just outstanding. And a lot of people may already know Kim Brophy's Meet Your Dog. I think that's a great resource. Christina's Stress Factor in Dogs. And then there's one on the brain that's really nice, Soft Wired instead of hardwired. Our brain isn't as hardwired as we thought. Therefore, neither are dogs' brains as hardwired. They can be changed. Brains are plastic, and knowing how the brain can be remolded and reshaped is really great information to have for everybody, and I highly recommend reading up on it. So here's how you can contact us. And I think that's it, Kathy.
Yeah, it's always fun to explore a topic with you.
Yeah.
Thank you all so much. That is a ton of information. And I know folks are going to be thinking about this one for a while, and I'm sure they're going to have questions later. One question that someone had during the presentation was, what kind of GI testing was done for the doodle that you talked about?
There's a GI lab in Texas. I think it might even be close to you in
Oh,
Austin.
maybe.
But anyway, that almost everybody sends their GI samples to, where there are several different panels you can choose from. I would choose one that looks at the microbiome for sure. And then you choose from the others based on region. And they'll look at inflammation, they'll look at immune-mediated problems, and a lot more with the C-reactive protein, for instance. And so there's a lot there. It isn't any one panel, and right now I can't tell you exactly which panel we sent out on that doodle.
Awesome. Thank you so much. That is amazing. I think we have stunned everyone into silence, but I'm glad that we have the contact information. So for sure, if folks have questions, please do reach out to Kathy and Linda. If you're in the Austin area, you're looking for resources, please stay tuned with us. This is our last webinar of 2024. It's really exciting. We have some big plans for 2025, but we're not ready to announce them yet. So stay tuned. If you're not already on our mailing list, please get on there so that we can announce our 2025 webinars coming out. Thank you again to everybody who decided to donate for this. We really appreciate folks who contributed to that. We are a 501c3 nonprofit. And thank you so much again to Kathy and Linda. We really appreciate you both so much. So y'all have a good one. Enjoy the rest of your 2024, and we will see you next year.
Yeah.
Have a good night.
Thank you so much.
Bye.